they showed proof of how the trauma actually messes with your brain and the DNA changes. It has effects on your limbic system, which is associated with your moods and your behaviors.
Your blended family has a 100% chance of success when you do it God's way.
We are Blended Kingdom Families, and we want to provide biblical resources to heal and restore families with a message of hope for the next generation.
Let's get after it.
Hey guys, welcome back to the BKF podcast. We are so excited to be with you today. If you haven't already, take an opportunity, like, share, comment, leave us a review, or you can send us your feedback at info@blendedkingdomfamilies.com. We're going to be continuing this month of May series on mental health, highlighting not only the importance of mental health, but our counseling center that we have in Colleyville, Texas called Seven Therapy. It's SEVN therapy.com. You can go and check that out. And today we're welcomed by an amazing therapist right here at Seven. So Vanessa, take it away.
Yes, you guys. So this is Sonia Narani. Did I say that right, Sonia?
Yes.
Narani?
Yes.
Yeah. And she is a graduate from SMU with a degree in psychology. She has her master's in child development health and received her second master's from Texas Wesleyan University in both LPC and LMFT. So she is a duly licensed therapist, y'all. Lots of knowledge over here. She is a mom to two vivacious girls. She is currently an LPC associate here at our counseling center at Seven Therapy. Her areas of expertise include crisis, trauma, varying mental health disorders. Sonia has specialized training in many modalities, including eye movement, desensitization, and reprocessing, which is known as EMDR, which is the coolest thing in the world, solution-focused therapy, strategic family therapy, and narrative therapy. And Sonia, welcome.
Thank you.
We're so excited to have you.
And she's talented.
So talented.
Man,
I know.
and raising two girls, that's just crazy.
Thank you. I appreciate that.
Yes. Well, you guys, and we're talking about a big topic today. So we're going to be talking about generational trauma and the impact of it on our lives. And so we know that so many people, especially with our community and blended families having gone through divorce, there's so many things that happens with that, or even the death of a spouse and remarriage and there's a lot of trauma that can happen there. And so Sonia, we're just going to let you take the floor and just kind of explain to us first, like what generational trauma can look like, you know, and maybe because some people may be like, well, do I have generational trauma, or what exactly that is?
Sure. So when we think of generational trauma, it literally is what it says, right? What the name is. So we are discussing families that have gone through several years, generations of not only like impacts from around the world, but also rape, domestic violence, abuse. So all of these things can kind of get into the system and unknowingly kind of take over our lives. So I'm sure you guys have heard of people saying that, oh, I've always been anxious, or I feel like I've always had depression, So that happens because of underlying, stressors that come from families that are carrying all this weight. In fact, 1966, there was a study done in which they actually followed Holocaust survivors and their subsequent family members over the years. And they showed proof of how the trauma actually messes with your brain and the DNA changes. It has effects on your limbic system, which is associated with your moods and your behaviors. And this really affects how we are as human beings, how we treat our spouses, how we treat our children. The things that we do in everyday life are impacted by such varying.
Wait, let me back up for a second.
Sure.
So what you're saying is it actually can be genetic.
Oh, absolutely.
Genetic trauma can follow generations. It can change your genetics.
Absolutely.
It's not just a learned behavior or a trained behavior or a trauma you experienced. You're saying that the study shows that it actually can change genetically.
100%.
Wow.
Yes.
Wow.
Because what happens when you go through a traumatic event, you alter your brain chemicals alter at that time.
Yeah.
And so generationally, the chemicals that are imbalanced are being transferred in utero. It's
Yeah.
being transferred via memory,
Yeah.
the ways that we talk about the trauma,
Yeah.
especially with hatred or severe biases towards different and
Wow.
stereotypes. Yes.
Wow. Wow.
And when we think about it, if you hear the older generation, we're like, oh, they're just old, and they have this skewed way of thinking about how different nationalities are, the
Yeah.
different
Yeah.
racial backgrounds
Yeah.
are,
Right.
and they might not be able to conform to, what we as today's generation are willing to accept. And
Yeah.
they feel like, oh, you guys all just want trophies and everybody's supposed to get a
Yeah.
good luck, thumbs up, but you don't understand that it's all politics or it's all of this.
Yeah.
But it's stemming from the trauma that we've created. Yeah.
Wow. That's
That just blows my mind.
Yeah.
And I study. I'm a behavior therapist, so I tend to relate everything to behaviorally.
Yeah.
Like, what did you learn, and how did you learn this? So the concept that
Mm-hmm.
that genetics can change, or that depression can be passed down generation to generation.
yeah.
That really is mind blowing.
Yes.
Well, even as a nurse, I mean, those are things that we learned about too. That, like, if because my depression and anxiety has been something that has happened in my family, and even with comorbidities. So, like, if heart disease runs in your family, the same type of thing. It can be passed down from generation to generation. And when you went back, when you were saying at the beginning, Sonia, like, I have this, or my family has always dealt with this. I'm thinking about, like, because divorce has run in our family. I'm like, oh yeah, because it's been like, and even though that's maybe not necessarily like a genetic
Yeah.
thing, but it's like, okay, I lived in a home where that was present. My mom lived in a home where that was present, and before, and then it happened to me, and so it's like you can see where it all like plays a part to kind of like where you get to this day. But also, like, we have the capability to develop healthy coping mechanisms and behavioral therapy to change that. I know when we got
Yeah.
married, we were like, hey, the dysfunction is going to stop with us. Like,
Absolutely.
no more. Because addiction runs in your family,
Yeah.
it runs in my family, and we both just were like, yeah, our kids are not going to experience that. And so
Right.
we both made a commitment, not only to ourselves but to our marriage and to our family, that
Yeah.
we weren't going to allow that to happen. And so what I love though about counseling is that there is hope,
Absolutely.
and there are tools that your counselor can help you with that can change that, so that your children and grandchildren don't have to experience
We have
that.
to break the cycle somewhere.
Yeah.
And it comes with educating yourself, being knowledgeable, and acknowledging it, right? Like, you
Yeah.
can't just go out and learn about all this stuff and then not apply it or, use it.
Yeah.
Once you learn something, apply it to your everyday life in order to actually break those cycles and those trends and those just
Yeah.
things that kind of actually are stopping us from progressing as a nation, as a country, in the world.
Yeah.
So
That's good.
I want to kind of dive into this two different ways. One is I want to understand how to identify it, because
Absolutely.
again, I think most people, say most, really have conformed their mask, and they've developed very calloused concepts around their emotions, and they just feel like if they can put them in a nice quiet box, we'll just live our life and go. So one, I want to talk about, how do you identify if you do suffer from generational trauma? And then the next thing is I want to talk about how we get over the stigma of like EMDR, because most people
Sure.
don't even know what that is.
Yeah.
And I want to dive
Voodoo.
into what it is and how good it is.
Absolutely.
But
Yeah.
let's talk about, how do you identify if you suffer from generational trauma?
Sure. So what I've seen typically for individuals that come here, or even couples that come here, as you said, you recognized it. You recognized that it was something that was going on within the family, and it was continuing to develop. Same thing with substance abuse. So that is a big inkling. If
Yeah.
you have it in your family, it's either going to continue down that line. It's not skipping generations because you're actively making a choice.
Yeah.
But it is a choice that you're making. Same with domestic violence. So sure, you guys have heard of over like counseling or even nursing. I married my dad.
Oh yes.
Or I married a woman just like my mother. She nags me the same way, or she does this the same way, yada, yada, yada. So those are recognition points.
Yeah.
So, and then of course, then there's like the physicality of it, the emotional, the way we handle our baggage, the way we handle our lives. We say that, I'm growing into my mother. I can see it. I can feel it. And it's like that. And it's
What you're
hard
saying
to
is
say.
so scary to people.
It is scary.
Like, oh my gosh, what am I doing?
But you recognize it, right?
Yeah.
Whereas my parents don't recognize it, but I can say, my mom did this because she was raised this way.
Yeah.
So it's not even giving her an excuse. It's just justifying why she is the way she is. And that helps me applicate what I want to and how I want to raise my children.
Yeah.
And whether it be something very similar on her path or something completely different. So those are some of the signs. Yeah.
That's good. Well, and I love, because you talked about the EMDR, and this is something that they teach us in my master's program I've been learning about, and there's special training for this.
Yes.
But it's kind of like remapping the brain for whenever we've experienced trauma and kind of pulling it into the place that the brain wants to like protect it, like self-protect, so to speak.
Yeah.
So can you speak into what EMDR is and
Absolutely.
the benefits of it?
Yes. Okay. So I absolutely love EMDR. For those of you that do not know about it, it's one of the most recent and most qualified ways of scientifically proven. Let me add that in there. Way of therapy.
Can you tell them what it stands for?
Yes, eye movement desensitization and reprocessing. So your brain is actually reprocessing the trauma because how you said that there's a part of your brain that kind of wants to protect it. What do we protect it with? Triggers. So we know where to run, how to use the fight or flight or fright movement, right?
Yeah.
How to freeze it, how to stop the time.
Yeah.
But what happens when we do that, we're putting all of it back into play, into action.
Yeah.
And you're realizing these traumatic events may not have anything to do with one another. However, you're replaying everything that's happened, putting it all up into one ball, throwing it back in your brain.
Wow.
So what EMDR does is, the way I look at it is, you have different compartments in your brain. So now you're going to actually dive back in and sort out every memory, including your senses, your body language, the feeling, the tension, where you keep it in your body, by using bilateral movements of the eye. Because EMDR has been viewed as something that happens in REM sleep automatically. How our memories develop, when do they actually get to the core? It's when you're sleeping, in the deepest part of your sleep. And so what happens in REM sleep is your eye movements are automatically happening, whether you notice it or not. That's just what happens. And that's where your dreams come from. That's where all of the stuff that has happened in your life, whether it be that day or over the years, so comes together. So EMDR really helps kind of like putting the pieces of the puzzle back to where they need to go. And allowing your brain to become accustomed to it in a way that if you desensitize it. So you're not, you're no longer like triggered. You'll be like, okay, if I'm watching a movie, something happens, I can not have a complete meltdown. I can recognize, okay, something similar like that happened to me. Okay, cool. Let's move on. Type of a thing.
And I want to point out, this is not done like in a hospital, and you're not hooked up like you're getting electrotherapy. I mean, I, to the lay person who hears this and is like, okay, you're telling me there's an answer to trauma, but this sounds a little like, okay, this is a little more different than like, tell me your feelings. This is different. And I want to say that's okay. And understand that there are methods of mental health treatment that is not like the 1970s, and we're not going to put something in there so you don't bite your tongue.
Lobotomies.
Lobotomies. I mean, I don't want to put these in the same categories. But I also don't want to, for a second, dismiss a scientifically proven method for handling trauma. Because, Sonia, as you said, I mean, I can think back into my deepest childhood memories, and the ones that come to me are trauma. Like, those are the ones I remember.
Absolutely.
I don't remember being 3 and being held, although I'm sure it happened.
Of course,
But I do remember being 3 and traumatic events happening in my life. So if that is what I'm carrying, and more importantly, if genetically that's what I've taught my children, I want to know how to be on the other side of that.
Absolutely.
So I want you to explain to anybody who's listening who says, I have trauma, I don't want to be like my mom, or I don't want to be like my dad, because I've heard a lot of people say that, and we love those people, but sometimes the behaviors are not what we want.
Right.
How does it look to be on the other side?
Oh, goodness. It is amazing. I actually had, while I was going through the training, I actually had my trainer perform EMDR on me. And I'm telling you, after one session, I felt like years of baggage were lifted off my shoulders. I called my mom from the car and I'm like, Mom, guess what? Like, I'm so over the moon happy. I don't even know why. And so I did a lot more research, and I got my own therapist who is EMDR trained here a little bit further away from us, and it worked wonders.
Yeah.
So I am telling you, when I say that EMDR may sound like hocus pocus or something that, we're tricking our minds or, no, we're not. We're actually just reprocessing and putting it back where it needs to go.
Wow.
Well, I love that. And I think what's so cool is just even from just how God created us, and how magnificent the mind is and how powerful it is, because that's where the enemy goes to attack us, is in our mind.
Yeah.
And so whenever we can remap or change our thinking, and that's why we talk a lot about, like, when we can pinpoint our triggers and know how we're being triggered, or know, like, physically, like what our body is doing, like, oh, I'm being triggered right now. Like, this is coming from a place of, something that happened in the past, XYZ. But when we can recognize that and, start changing those thought patterns, it really changes, because whatever we think, we speak, and what we speak then can turn into actions, right? And so to break those generational cycles of trauma, whenever we can implement these things and do it, a lot of people are against medicine. A lot of people are like, I don't want to be on an antidepressant, or I don't want to be on, ADD, medication. And so, what I love about EMDR is it's you don't have any of that. It's, I've actually seen it performed in our classroom, with Dr. Cassie Reed, who has been on our podcast. But I love that God has made the body like that, and that it can self-repair without having to take on medication or things like that. So for those who maybe, are sensitive to medications and don't like to do that, this is an amazing resource that you can implement with your therapist that can help you, break these generational traumas.
I'm just trying to, like, come to grips with these things that are out there. And again, everything that we try to do, not only through ministry work, but all through through our counselors, is we just want to help you live a healthier, happier life. We want you to be in line with what God wants with your life, and how many blessings that he wants to bestow upon you. But we can't deny the fact that we do carry trauma.
Absolutely.
We just can't. It's like a backpack of emotions and events that in most cases are weighing you down from the blessings that God wants for your life. So take the concept of tools, take the concept of counseling, and understand that it can be good and it can be so healthy for you. And I love what you just said about the non-medication route. It's not that as counselors we're anti-medication, but that's not really our bag of tea to start prescribing.
Right.
That's not what we do.
That's not what
so counselors don't do that. We try to treat either behaviorally or through scientific methods to help people get healthy without medication, or at the very least get off of medication.
Absolutely.
So again, any last closing thoughts, either one of you guys, on trauma or what we can do with this?
Yeah, so thank you again for having me here. But yes, I would like to add, please come see us. EMDR is a wonderful modality, and it's scientifically proven. Look it up, Google it. You'll find so much information. It's relatively new, so it's still like untouched, unheard of. So a lot of people just like are deterred, but we're not using anything that is mechanical. We're not probing your brain. We're not using medications. We don't even ask you to do homework. You know, like people are like, oh, what am I supposed to do at home? I'm like, nothing. Just drink a lot of water because you might be, you might think of things that happened around that time. So it's wonderful. It's really a fantastic modality.
Love that.
Oh, it's good.
So if you're interested in getting EMDR therapy, again, 7 Therapy, we're actually located in Colleyville, Texas. You are more than welcome to give us a call. That email address is SEVN. We spelled it differently, so don't spell 7 the regular way. 7therapy.com. You can go check out our environment. It's absolutely unique. And you can actually schedule an appointment with Sonia and go through EMDR therapy.
Yeah.
So, guys, thanks so much for joining us today. We hope this has been a blessing to you, and we can't wait to see you next week. Y'all take care.
Be blessed in all that you do.
Bye.
Hey guys, so glad you were here with us today, and I hope you enjoyed today's episode.
And you can find more resources from Blended Kingdom Families at blendedkingdomfamilies.com. Join us again next time as we hang out with more amazing podcast guests. And remember, nothing will be impossible with God.